It's time for your healthy dose of information from Hannibal Regional Healthcare System. And joining us here in Studio H this morning, it's the CEO, President of Hannibal Regional Healthcare System, Todd Ahrens. Good morning, sir.
Good morning, Greg. How are you?
Doing great. How are you?
Well, good. I guess neither one of us would be here if we'd won the lottery last night, right?
That's what I was saying earlier, is we're all here, so I guess none of us won the Powerball.
I certainly did, so.
Well, we appreciate you coming in and talking with us this morning and telling us about all the great things happening at Hannibal Regional Healthcare System. You've got a number of exciting things going on.
Oh, yes, we do, and certainly thanks for having us. You know, one of the things we're certainly excited about starting at the first of our fiscal year, which was October 1st, was a new inpatient rehabilitation service. So those patients that need really extensive rehab therapy, usually more than 3 hours a day, can access that service through Hannibal Regional Hospital. And that keeps those patients local. A lot of times in the past, when we didn't have that service, those patients would have to travel to Columbia, St. Louis, other locales that have it. So that's one of the really exciting things that we kicked off about 4 months ago.
Yeah, you talk about your mission, and your health is our mission, is your motto. Now, the thing is, for the public, this means a lot, because just what you're talking about there, it wasn't that long ago when people had to go to other areas to receive specific treatment, and now you can just do that right here.
Sure. You know, our board of directors made the important decision to change our focus, which is what really a mission statement is, our core purpose for being. So they changed that from really focused on providing great health care, which obviously we still want to do, but making sure we're improving the health of our communities. So anything that will improve the health of our communities is something that's within our area of influence, so to speak. So one of the things we've been doing is making sure we have those specialties that our citizens need available locally, so they don't have to travel to St. Louis or Columbia to access those services. So with that, we're also excited to announce that a number of physicians have joined our organization within the last 3 or 4 months. These are all board certified physicians. We brought on Dr. Purvi Parikh. She's a board certified endocrinologist, as well as her husband, Dr. Pranav Parikh. He's a board certified pulmonologist and is also serving as our chief medical officer. And in addition to that husband and wife team, we've also recently been joined by Dr. Kevin Imhoff. He's an otorhinolaryngologist, more easily pronounced as an ear, nose, and throat doctor. And then Dr. Stephen Cockrell is a urologist that will be joining us in February. And then lastly, we brought on a new cardiologist, Dr. Satish Kodali, and Dr. Michael Tentori is a primary care doctor who's serving our patients out of our Canton location just up the river from here. So a lot of good stuff, exciting stuff going on in Hannibal Regional Healthcare System.
It sounds like it all amounts to a lot of growth.
Well, there's a lot of need in the area, certainly with the Affordable Care Act and other things that are happening politically. We're finding a lot of patients are looking and having trouble accessing care. So I think you're seeing a lot of healthcare systems, not only ours, working on ways to make sure those patients have access to the care they need. So part of that's through physicians, part of that's through bricks and mortar. Part of it is bringing additional capabilities like that inpatient rehab that we talked about earlier.
Well, and it's not only doing it right there in Hannibal, but doing it in all the rural communities as well.
Sure. We have clinics in Canton, Monroe City, Shelbina, and Bowling Green and Louisiana, Pike County, Missouri. So we want to make sure that the citizens in those outreach areas don't feel compelled to drive a half hour, 45 minutes, especially for primary care, which is something with sick kids, especially during the flu and winter season. A lot of folks need access to care, and it doesn't work real well if they have to drive an hour each way to get it.
Well, I know as the CEO and president of Hannibal Regional Healthcare System, you're constantly looking at what's next. What is next for healthcare? Because there's been so much advancement, not only in the technology, but as we just mentioned, in the coverage area too, of serving the patient. Where do you go from here?
Well, we're obviously working in lots of directions, but probably the best one that answers your question is really a focus, like we talked about earlier, on our health. So when you talk to folks that work in healthcare, you're going to hear them hit on the term population health. Which is really something that the Affordable Care Act, sometimes referred to as Obamacare, is driving us to. And that's really looking at how we're improving the health of populations. really making us be responsible and doing things to improve health, even when they're not necessarily patients of ours. So, making sure we have education programs, things that will help citizens that have, diabetes, high cholesterol, high blood pressure, other chronic diseases, do those things to improve their health. And so that's where a lot of organizations, including ours, are focused right now.
What do you hear from the public? Because I'm sure there's a number of things, especially with all the advancements you made in technology, where the public comes in, receive treatment, and then come back to say, wow, I had no idea that, it was like that, or that we could do that right here.
Certainly in Hannibal, we're privileged to have, a very nice facility. We have other medical providers that aren't a part of our system on campus. So we usually are always being recognized by those folks that come into town for care as having care that's far in excess of what you would expect from an organization our size in a community our size. So, that's always a good thing, but, the key is really, our great team. And we have, better than 1,000 team members that, provide this care on a daily basis, as well as physicians that aren't necessarily employed by the healthcare system. And those are the people that drive us. They're the ones that are succeeding on a daily basis and in providing that exceptional care, which is really, at the end of the day, what a patient's looking for when they step on our campus.
And one of the big things that you've done here recently is the new Linear Accelerator.
Yeah, we're very excited about the new Linear Accelerator in the James E. Carey Cancer Center. That cancer center was opened in 2003, so when we replaced that a year ago December, that technology had been new to when the building was completed. But that new Linear Accelerator brings new technology to those folks that need to have their cancer treated by radiation. And the technology is in some circumstances, for some cancers, is even approaching the effectiveness of surgery. So the technology is really enhanced, and we've seen an increase in the number of visits to our radiation therapy services, and part of that is just having the best and newest technology in the area.
Yeah, including a new MRI system, too.
Yeah, the new MRI system, MRIs are not new technology, so to speak. We did bring in the most current technology with the addition of the new system, but the really exciting thing about the new MRI is an additional capability we brought in with it. So those patients that have some anxiety or claustrophobia issues related to being in a confined space for a period of time while that test is being completed can now actually watch a movie through glasses and hearing capacities, so that instead of having to sedate those patients to undergo that exam, sometimes they can avoid that sedation by watching a video they bring in with them, which obviously reduce their cost. It produces a better exam result because we don't have movement and other things that will affect that. So that new technology is neat. We certainly want to try to make the care we provide most convenient to our patients, and avoiding sedation by using that additional technology is something new in the area.
Yeah, convenience, and also that it be more pleasurable too. I mean, in the process, I'm sure that we could all tell stories and will in the future of, well, back in the day when I had an MRI, it was like this, or, when I had cancer treatment, it was like this. Things are rapidly changing.
Oh, I agree. I had an MRI 3 or 4 years ago, and I'm not a claustrophobic or an anxious person, but sitting in there for those 40 minutes, I was wanting to chew my fingernails and everything else. So
a little stressed.
Yeah.
Yeah, and you have all the different thoughts that go through your mind at that time. But not only do you have the good technology, but the great staff there at Hannibal Regional Healthcare System that is there for the patient too.
Yeah, Greg, I'd be remiss to not talk about how great they are. They're the ones that are, taking care of patients on, Christmas and Thanksgiving and New Year's and other times when the rest of us are doing things to celebrate the holidays. They're there 24 hours a day, 7 days a week, and I can't say enough positive things about the great team we have at the healthcare system.
Yeah, what a great dedication to profession that you see in these people and how they serve the public.
Absolutely. I probably don't do enough to, thank them personally when I see them out and about within the healthcare system. But it's a service that, couldn't be done not only with the team members, but, we also have 260 auxilians that provide volunteer services to the healthcare system, probably the equivalent of 15 full-time employees. So it's not unusual for healthcare systems to have access to that sort of great team members, but we're certainly head and shoulders above a lot of organizations when it comes to the team that provides the care at the healthcare system.
You bet. How do people get more information about Hannibal Regional Healthcare Systems or access to the services?
Sure, lots of ways, Greg. Obviously, the internet's the easiest way, probably, hannibalregional.org. You could also just call our number, 573-248-1300, or get on Facebook and like us. We provide a lot of social media information out there for folks looking for healthcare, ways they can access us. So any of those three ways are probably the best.
All right. Again, HannibalRegional.org is a website. You can call 573-248-1300, or you've got the social media aspect there too on Facebook. That's good stuff. It's Hannibal Regional Healthcare System, and here in the studio with us this morning, CEO and President of HRHS, it's Todd Ahrens. Sir, thanks for coming in today.
My pleasure. Thanks for having us.
Appreciate it. Thanks for coming in. It's Hannibal Regional Healthcare System's Healthy Dose of Information.